Linda Boxer,
Present.
Allison Brashear,
Here.
Deborah Deese,
Here.
Anne Marie Dulege,
Yes.
Isabel Duron,
Here.
Elena Flowers,
Present.
Judy Gasson, Larry Goldstein,
Here.
David Higgins,
Here.
Steve Julesgaard,
Present.
Linda Malkus,
Here.
Dave Martin, Shlomo Melmed,
Here.
Lauren Miller Rogan,
Here.
Adriana Padilla,
Here.
Joe Panetta, Francisco Prieto,
Here.
Robert Quint,
Here.
Al Roulette,
Here.
Michael Stamos,
Here.
Oz Stewart,
Here.
Jonathan Thomas,
Here.
Art Torres. Art, you're on mute. I will come back to Art. Okay.
Here.
Thank you. Christina Vori, Diane Winokur, Keith Yamamoto.
Here.
Thank you. We have quorum.
Maria, Dave Martin is here also now.
Thank you, Dave. Now we really have quorum.
Thank you, Maria. Thank you, everybody. For those of you who weren't able to make our meeting Monday, we had a great session with 14 outside experts from a variety of walks who listened to a full day session on what CIRM is doing, the sorts of grants that we are funding as presented by 10 different grantees, and it led to a really in-depth, highly participatory discussion on suggestions for CIRM as it puts together the strategic plan for the next iteration in light of the passage of Prop 14. We are going to, for those who did not make it, I was a recorded session you can watch. Maria, perhaps you could tell them where that is. And in any event, Dr. Milan, who did an outstanding job of running that session, and I are going to be presenting a report to the board for discussion at our March board retreat. So it's not something that's on the agenda today, but just wanted to make note of that and to thank everybody who was able to participate and look forward to the discussion in March when the board gets the full report. Maria, where can they see the session?
It's not posted yet, but it will be shortly, and then I can send everyone a link.
Great. Okay, thank you very much. So on to
JT, I thought you might want to have the new board members introduce themselves.
I'm going to, that's my next thing.
Oh, great.
So before we get into the action items, I wanted to have our, is Dr. Abdul Haq, are you on? Did I hear you?
Yes.
Yes.
Right. Okay, so we're going to have Doctors Abdul Haq, Flowers, and Stamos introduce themselves to the board as new members, as is our tradition.
And Dr. Watson.
Art, she is just joining as a member of the public today. She will be an official board member in March.
Well, we should still introduce her as a future board member.
Okay. We also have Dr. Fisher Colbury on as well.
Great.
Okay, Dr. Abdul Haq, we'll start with you.
Thank you very much. My name is Haifa Abdul Haq, and I am a hematologist oncologist at UCSF Fresno. I'm the director of hematology at UCSF Fresno and the director of the fellowship program. I'm actually very honored to be part of this board, and I'm looking forward to working with everybody towards serving the people of California and especially the people of the Valley. I am trained in hematology oncology, and I've worked in bone marrow transplant for a couple of years in Pittsburgh before coming to Fresno. So one of my really big goals for the area of the Valley is hopefully to establish a cellular therapy program.
Thank you. Dr. Flowers.
Good morning, everyone. My name is Elena. I'm at UC San Francisco. I am a cardiac nurse and now faculty in the School of Nursing. My research is primarily focused on sort of a precision health approach to preventing type 2 diabetes, and particularly in the highest risk racial groups. I was appointed to the board as a new board seat specifically for a nurse, and I'm really committed to addressing kind of the broad, diverse needs of the state of California, and really happy to be here with you all.
Thank you. Dr. Stamos.
Good morning. Thank you. Michael Stamos here. I'm a professor of surgery and the dean of the School of Medicine at UC Irvine. Background, busy clinical surgeon, clinical trialist, and outcomes researcher. Thank you very much for including me.
Okay, and then we'll go to our soon-to-be sworn-in members who are attending as members of the public, but will be joining us formally in March. We'll start with Dr. Fisher-Colbury. Mark, are you on? Maria, do you see him on there? Is he on mute?
Sorry about that. Yeah, thank you. While I'm not a doctor, I do happen to hold patents in therapeutics and diagnostics in a 30-year career in the life sciences. And related to the activities on CIRM, I'm formerly the chairman of the Juvenile Diabetes Research Foundation and a 20-year volunteer with GRF, holding a variety of roles with the group. I'm truly honored to be able to participate with the CIRM board. So I'm also the CEO of Stratios, which is automating early stage drug discovery and synthetic biology and other areas of life sciences to allow people to accelerate research by accessing a fleet of automation over the cloud. So we hope to expand research tools and capabilities for everybody. So thanks.
Thank you, Mark. Dr. Watson, last but not least.
Hi, I'm Carol Watson. I'm a cardiologist at UCLA. I run the preventive cardiology program. My background is in vascular biology. I have a PhD in that. And more recently, I've been involved in diabetes prevention. I'm an investigator of the diabetes prevention program and cardiovascular disease prevention, investigator with the MESA multi-ethnic study of atherosclerosis, MESA. So I'm very interested in all of the activities of this committee. I'm very honored to be here. So thank you for welcoming me.
Well, thank you very much. And thank you, all five of you, for your interest in joining the board. And as we talked about, I think you'll find this to be a tremendously worthwhile and rewarding experience on behalf of patients everywhere. So we really appreciate your interest and participation. So thank you very much. We're going to go on next to the action items. Number one is consideration of appointment of members of the Accessibility and Affordability Working Group. We have one new member to announce today. That is Dana Goldman, who is the director of the Schaefer Center for Health Policy and Economics at USC, which fills the healthcare economist slot of the 10 members listed in the proposition to join the working group itself. We need to formally approve Dr. Goldman, and so do I hear a motion to that effect?
I motion.
Moved by Dr. Duliege. Who is the second? Sorry.
Judy.
Second by Dr. Gasson. Thank you. Any discussion by members of the board? Hearing none. Any discussion or comment by members of the public? Hearing none. Maria, will you please call the roll?
Sure. Haifa Abdulhaq,
Yes.
Dan Bernal,
Yes.
George Blumenthal,
Yes.
Linda Boxer,
Yes.
Allison Brashear,
Yes.
Deborah Deese,
Yes.
Anne Marie Dulege,
Yes.
Isabel Dron,
Yes.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Linda Malkus,
Yes.
Dave Martin,
Yes.
Shlomo Melmed,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta, Francisco Prieto,
Aye.
Robert Quint, Al Rolette,
Yes.
Michael.
Yes, sorry.
It's okay. Thanks, Dr. Quint. Michael Stamos,
Yes.
Oz Stewart,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Vori, Diane Winokur, Keith Yamamoto.
Yes.
Motion carries.
Thank you, Maria. Item number 4, consideration of amendments to the grants working group bylaws. We have a presentation on that.
Yes. So good morning, members of the board, CIRM colleagues, members of the public. Give me a moment as I share my screen. I just have a brief presentation here. So these are proposed amendments to the grants working group bylaws. And so the bylaws for the GWG, as we refer to it, outline the responsibilities, functions, overall process of the GWG. And so we update these periodically to provide clarity where needed, or to provide additions or changes as the process or rules change. And so with Prop 14, we have a few additions and modifications that need to be added. And so I will summarize what those are briefly. So through Prop 14, we have the addition of what are called ad hoc members to the GWG. These are scientific members, and so the corresponding definitions are now included in the bylaws. There is the addition of a minority report requirement for applications that receive a fundable score by 35% or more of the GWG. There is a clarification that the ICOC may deem a research category a vital research opportunity by a majority vote. This is a new addition where it was previously the GWG. There's a clarification that a score of a 2 for clinical applications, so those applications are scored on the basis of 1, 2, or 3. So a score of 2 is considered provisional until the grants working group reviews the submission by the applicant in order to address reviewer questions and concerns. And then finally, there are a few scattered minor edits to conform language to that, which is found in Prop 14. And so with that, we request the board approval to those proposed changes to the grants working group bylaws. Thank you.
Thank you, Dr. Sombrano. Do we hear a motion to that effect?
So moved. This is David in San Diego.
Seconded?
Second. This is Haifa.
Thank you. Comments?
Mr. Chair?
Yes.
Just for my own clarification, when I see the word minority, I immediately jump on it. So can they clarify for me what exactly you mean by adding the minority report so I understand what you're talking about?
Sure, absolutely. So the minority report means that a minority of members on the grants working group who vote in favor of an application. And so the minority report is basically highlighting the strengths and weaknesses of the application from their perspective, so that we have just a balanced presentation of what the overall assessment by the grants working group was, not just the majority of the working group, but also the minority perspective.
Thank you for the clarification. Could you also clarify for me one more thing? I know that we had been discussing this for months. We have added it as a, I guess it's a policy or part of, in which we are requiring researchers to provide a a part of the plan in the application to show the engagement of a proportionate number of minority or ethnic and racial groups. Is that reinforced in any way? I just don't want it to become something we did, but it's not enforced by the working grants group. I got an impression last year in reviewing that which they had reviewed that that it was sort of willy-nilly how they looked at it, and that researchers didn't always pay attention to that requirement as much as I would have liked to have seen, or they took it seriously. So I just want to know that in whatever language we're approving and or however we approve what we're doing, excuse me if I don't have the right words for it, that is front and center, that they understand that, you know, this is something that we really care about, that they have to show in that research proposal that we have a proportionate representation of racial and ethnic minorities included in that research, and that the working grants group is also very clear that is a very pointed request that they need to look for. I don't know how clear we've made it. I just want to make sure that the clarity is there as we add, change, update any of our policies. May not need to say it, but I just wanted to say it because we have some new members as well. And I'd like them to know how we are trying to move this kind of equity and equality forward in terms of representation of some of the most highly impacted communities represented in the research that we're doing. So I want to make that statement, Gil. This is nothing to do necessarily with whether or not those 4 or 5 issues you raised include that, but I want to make sure that we're very clear about that as we move forward.
Yeah, no, absolutely. And so we have included that in the program announcements and the RFAs. So we have raised that element to be a specific review criterion. So in the past, we used to have 4 central questions that the grants working group focused on in assessing applications. Now there is a 5th, which revolves around the underserved communities and ensuring that those needs are addressed. So that includes looking at race, ethnicity, sex, gender distribution, enrollment into clinical trials, as well as their consideration in their work plan. And then we have, in addition, added a sort of a DEI section that is broader in scope that applicants will address. And so at the moment, we're working on the guidance that we're going to provide the grants working group in order to assess applications in this way, which is also important as we begin to see what we get back. So that is in progress, but it doesn't directly impact the bylaws.
All right. Thank you. Thank you, Mr. Chair.
Chair.
Yes, yes, Dan.
Are all of the amendments that are being proposed being made in order to conform to the provisions of Prop 14, or are there any amendments that fall outside of that besides minor technical corrections?
They are primarily to address Prop 14 changes, so including the minority report element, that those are all due to Prop 14.
Are there any significant amendments that fall outside of conforming to Prop 14?
So the only one that falls outside is deeming a score of 2 a provisional score, but that is intended to tie in with the minority report in terms of just, in practically speaking, how we implement it. So it is related to it, but not directly coming from Prop 14.
Thank you.
Other comments or questions from members of the board? Any comments by members of the public?
JT, this is Oz. Actually, I do have a question, if I could.
Please.
So, Gil, this is with regard to the issue of things that are inside scope, out of scope, and considered to be extraordinary research opportunity. So now this moves from the GWG to the board. And I wonder if you could just sort of explain. So if a grant comes in that is not considered either in scope or what already recognized, then does CIRM send it to the GWG for review or not? And then my basic then question becomes, at what stage of the process would the board actually consider and vote upon that new designation? Thank you.
Sure, absolutely. So there's a couple of examples that I can point to which are basically the ones that we have done in the past. So one being gene therapy. Before Prop 14, gene therapy was an area of research that was not within scope if it did not involve stem cells. So the way it would work is that we would bring a concept or idea that an area of research should be a vital research opportunity. And so we bring this to the board, and the board would, presumably approve or not approve. And if it's approved as a vital research opportunity, then we would include that within the eligibility criteria in our programs. And that could be broad, it could be narrow, it could be restricted to certain funding opportunities and not others. So it'll be dependent on the pleasure of the board in that regard.
Thank you. And just a follow-up question, if I could.
Sure.
So, and I'm not sure quite who would do this, but is there an opportunity for an investigator-initiated request for consideration for an area of research to be considered by CIRM?
So currently we don't have one where it's an ad hoc process, but rather it's we're attempting to make it more formalized. So what informs the area of research is our strategic planning process, advice from scientific advisory panels, general feedback that we get from the community that we then bring back to the board. Or if the board itself identifies an area of research that they feel is a vital research opportunity, that's also an avenue. But otherwise, there isn't an ad hoc process.
Okay, thank you. And I just wanted to kind of have you answer that, because there was a discussion before about sort of a reign of proposals or requests for consideration. I think this is actually a very good way to do that. It's something that would be initiated by CIRM, not by ad hoc request. I think going forward in that way is a good plan to maintain both the standardization and a level of control in the whole process. So thank you very much. I think it's a good solution.
Thanks, Oz. Any other comments by members of the board? Any comments by members of the public? Hearing none.
I think I'll call roll. Pefa Abdulhak.
Yes.
Thank you. Dan Bernal.
Yes.
George Blumenthal.
Yes.
Linda Boxer.
Yes.
Allison Brashear.
Yes.
Deborah Deese.
Yes.
Anne Marie Dulege.
Yes.
Isabel Dudon.
Yes.
Elena Flowers.
Yes.
Judy Gasson.
Yes.
Larry Goldstein.
Yes.
David Higgins.
Yes.
Steve Julescard.
Yes.
Linda Malkus.
Yes.
Dave Martin. Shlomo Melmed.
Yes.
Lauren Miller Rogan.
Yes.
Adriana.
Yes, for Dave.
Thank you, Dave. Adriana.
Yes.
Francisco Prieto.
Aye.
Robert Quint.
Yes.
Al Rolette,
Yes.
Michael Stamos,
Yes.
Stewart,
Yes.
Jonathan Thomas. Did we lose JT? Okay. Art Torres
Aye.
and Keith Yamamoto.
Yes.
The motion carries. Art, I think, do you want to continue with the meeting? Sorry to put you on the spot like that. I think JT is trying to reconnect.
Oh, okay. What's the next item?
It's the Gill show today, so Gill is our next item.
Calling on Mr. Gill and his agents.
So I think the next item is nominations for grants working group members. So we have the proposed nominations for new members, as well as reappointment of some old members. So those members include Dr. Marcella Maus.
Just a moment, as a member of the chronologically gifted community, I don't think you should say old members.
More experienced grants working group members. Okay, so the new members are Dr. Marcella Maus, Joseph Mellenhorst, William Parenteau, John Strauss, and Alan Sugar. And so these are new members. Our more experienced members who seek reappointment are Doug Kerr and John Wagner. And so you would like these members approved as GWG. So back to you.
Right. Is there a motion?
So moved.
Second? Is there a second?
Second.
All right, it's been moved and seconded. Any further discussion on this item? Any public comment?
Yeah, just a question for Gil.
Yes.
Can you describe to us how these scientists are chosen? Is this an internal scientific review by staff and by the president, or how do we choose the best scientists for this group?
Yes, no, that's a great question. So we go about it in different ways in terms of identifying these members. So a lot of it is through recommendations from either existing members that we have, or through our own outreach, through meetings and identifying people at conferences or other arenas where we know expertise exists. We often have members participate as specialists. So a specialist will come in to fill in expertise gaps as needed for a review meeting. And so that often will give us an initial sense of both their expertise and relative commitment, and just their general ability to review in our setting. And so I think that all those elements combined will usually have us then provide these recommendations to you as members of the GWG.
So can I think that the board should be assured. I mean, I trust what you say, and I like your approach. But we should be assured that the absolute best scientists available are actually on our panels. And I'm not hearing from you a formal process for who makes that ultimate decision to bring those names to us. The process that you outlined sounds terrific, but I'm wondering if we shouldn't have a more formalized approach to choosing the best scientists. Are there gaps? We don't know. We don't hear that from you.
Right. So there are gaps, and so certainly part of what we attempt to do is identify people who are willing and able to participate. So certainly, as you mentioned, availability is also key. Ensuring that, as we reach out to what we believe are the best scientists and reviewers in an arena, is that they're going to be willing to participate. So, there is an attrition, if you will, in our search for some of these folks. And so those that we bring are those that at least have been vetted to the extent that they've participated to some extent. That decision is made, in terms of who we bring by myself generally with approval from Dr. Milan in terms of ensuring that these folks are up to par.
Well, then the question is for Maria, if she's satisfied that she's getting the best and most diverse, intense science reviews that she needs. Do you need Maria? The question is, do you need a more rigid, formal process for assuring the quality and the breadth and depth of our reviewers?
Dr. Melmed, this is a topic that's on our to-do list. I would like to formalize the process, and we'll be bringing something to the board.
Thank you.
Thank you.
Can I step up now, Mr.
Yes.
Chair Assistant, brightest bulb in the room, Mr. Torres? Thank you.
Well, I'm not the chair's assistant. I am the acting chair. Please continue.
Thank you very much for the elemental decision. Anyway, Melmed raised an issue, and I'm going to sound to some of the new members like a broken record. But also, even as we were talking about the list, the first thing I said is there's a lot of men there. The second thing I thought about is I do not know the composition of this group and the racial, ethnic, gender breakdown, even as I heard a lot of men on the list. And so to Melmed's point about, really great scientists, sometimes the brightest bulb in the room is not always the one that you need at the table. And I'm concerned, Maria, and I hope as you looking at this, whether or not we're including in the pipeline representatives from to make sure that we're having racial.
Can people mute themselves, please? It's getting a lot of feedback. Go ahead, Mr. On.
Even as we're trying to address equity and equality, we need representation from the scientific community as well to represent both the community of California, and we need to make sure that we're getting into the pipeline. Perhaps some of our
Maria, where were we?
JT, Isabel has continued to speak, and we're going to get to the next item, which is item number 3, once you get back online. Go ahead, Mr. On.
Thank you. And so I'm thinking, Maria, that even as you start to look at this formalized process, that we work very hard to reach out to scientists of color, racial, ethnic, and women to make sure that we bring new thinking, fresh thinking, new lenses to the whole process. And that's what I'd like to see when you come to us at the next meeting.
Both excellent recommendations. And of course, I just want to reiterate, availability, logistics has always been an issue in getting the best candidates. But I think it's also important for members of the board to submit names to Gil and Maria once the process is revised again, so that their input, board members' input, are important of people that we should include on any future list that we may not be aware of or have not come to our attention. So is there a motion? We have a motion on the floor in a second. Any public comment or further comment from members of the board?
Yes, could I insert a comment here? I raised my hand, but that doesn't seem to attract attention. So I apologize for breaking in.
That's quite all right. A whistle will do.
Okay. I've served on numerous study sections for NIH and American Cancer over the years, and Gil may have addressed this in passing. I couldn't quite tell, but there was a tradition in many of these groups of having members serve as temporary members of a group before they were appointed as permanent, because that allowed the members of the group, the chair, the staff, to evaluate expertise as well as their ability to work with other members of the grant review group, which is also an important dynamic. You need people to be able to work together.
Excellent point again, and I'm sure Maria and Gil will take that into consideration. Any further comments from members of the board on this item? Any public comments? There being none, Maria, please call the roll, and then Dr. Thomas, we will next consider when you take back over item number 6. Maria, the roll.
Thank you, Senator Torres.
Val Duhawk.
Yes.
Dan Bernal.
Yes.
George Blumenthal.
Yes.
Linda Boxer.
Yes.
Allison Bashir.
Yes.
Deborah Deese.
Yes.
Anne Marie Dulege,
Yes.
Isabel Grun,
Yes.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgaard,
Yes.
Linda Malkus,
Yes.
Dave Martin,
Yes.
Shlomo Malmed,
Yes.
Lauren Miller-Rogan,
Yes.
Adriana Padilla,
Yes.
Francisco Prieto,
Aye.
thank you, Robert Quint,
Yes.
Al Rolette, Michael Stamos,
Yes.
Oz Stewart,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Keith Yamamoto.
Yes.
And then let me go back. Al, are you still on? He's on mute. Okay. Motion carries.
Thank you, Maria, and thank you very much, Senator Torres, for stepping in during the technical difficulties. Next, we go on to a presentation on one of our 5 pillars at CIRM, which is consideration of adoption of the education concept plans. Dr. Sombrano, I believe you're doing the presentation.
I am. And so I'm going to share my screen once again. All right, so we're bringing to you today for consideration concept proposals for bridges and a research training program. And just as background, we have offered funding opportunities to support training and workforce development in stem cell-based research through our education pillar and a variety of programs. And so today we're proposing the relaunch of 2 of them, the Bridges and Research Training programs. We also have another called Spark, and I'll show you in the diagram in the next slide. And a concept for that we will bring back to you at a later date. Also, I want to note that the CIRM board at its last meeting requested that a proposal for a possible supplement to the current Bridges Training program be considered. And so we are doing some refinements and adjustments to that, and we're going to bring that proposal to the March ICOC meeting. So this slide, just to give you a flavor of what we have done in the past with our training programs, starting very early, as I think somebody had mentioned previously, we started CIRM funding opportunities with training actually back in 2005, 2006, which was the research training program. But across the board, we have supported over 2,700 trainees across all our different programs, and we have supported trainees from high school, undergrad, masters, through clinical fellows in the past. So let me focus in on the Bridges program specifically and on the concept that we're proposing here. The objective of this program is to enable training that is going to significantly enhance the technical skills, knowledge, and experience of a diverse cohort of undergraduates and master's level students, particularly from California state universities and community colleges. So it is a focused program. It is intended to foster commitment among the trainees to the goal of accelerating the delivery of stem cell-based and gene therapy treatments to patients with unmet needs, also to broaden participation in regenerative medicine of individuals representing the diversity of California's population. In addition, we want to create a cadre of technically skilled stem cell ambassadors with an awareness and approach of inequities that impact development of therapies for all people, to promote trainees' efficient transition into careers in the life sciences and regenerative medicine by directly linking the educational programs at their own institution to organizations and companies that are focused on stem cell and gene therapy research and related disciplines. That is, we're trying to create opportunities or a bridge for these students that may not otherwise have access to cutting edge research and facilities at their own institutions for stem cell and gene therapy research. So the way the Bridges training program works is there is the awardee or the home institution, as we call it, which is responsible for the management and coordination of the activities, as well as the recruitment of the trainees. And so the trainees that are recruited need to be integrated into a degree or certificate program at their institution. And then the research internships, which usually take place for about a year, take place at a partner or host institution. And those are either a biotech or pharmaceutical company, a research university or institution where cutting edge research in stem cell or gene therapy is occurring. The program also requires educational enhancement activities to prepare the students for the internships, including an advanced cell culture techniques course, patient or patient advocate and healthcare engagement activities, to engage trainees with patients or patient advocates and provide insights into the challenges of developing new cell therapies and drugs. In addition, there are community outreach activities that are part of the program to educate others. So this is where the trainees themselves do outreach into a varied community to educate about stem cell and gene therapy, but also to gain awareness of the socioeconomic issues and disparities that exist. The trainees also receive advice and career development guidance to ensure that they move on to either a technical career in stem cell research or advance to higher education, going into grad school or something like that. There are some award priorities that we want to highlight. So as part of the requirement under Prop 14, we will prioritize applications under this program that offer matching funds or verified in-kind support, as well as applications that are going to enhance the geographic distribution of training and socioeconomic diversity. So the proposed budget allocation for the Bridges program is as follows. We would request an allocation of $65 million that would support about 18 awards. And each award would have a 5-year duration. And it would be approximately $3.6 million per award in order to support 10 trainees per year at that institution. And so the award itself supports trainee stipends, tuition and fees, research supplies, coursework, and program administration. And so that's a summary of the Bridges program. And so for that, we're requesting board approval of the Bridges training program concept with an allocation of $65 million.
Thank you, Dr. Zambrano. Do we have a motion to that effect?
Move it.
Moved by Senator Torres. Is there a second?
Second, David.
Seconded by Dr. Higgins. Are there comments by members of the board? We'll start with Senator Torres, who I know will want to comment.
This is probably the most valuable program we provide for the future of the state of California. And whether it's the governor or whether it's members of the legislature, there's always commentary about this program when I raise it with them, because they know how important it is to train future scientists within our institutions. And clearly, as a member of the Board of Regents of UC, they also recognize what we've been doing here in terms of working with us. And also in some cases, as I know Maria and the chancellor at UC Santa Cruz are working on, is to implement further programs and PhD programs that we can work in partnership with the University of California and CIRM. What's also important is that many of these graduates from these Bridges programs find themselves jobs after they've finished with their internship or their graduation. And many of them, I think, Gil, at some point you might want to send out, especially to the new members, a history of all our Bridges people and where they're presently located. Some of them are running labs, some of them are assistants in labs. What's important is that these young people have found positions within the stem cell science field, not only in California, but across the nation. And we really are providing a very important role here. Secondly, and as something I know Isabel is very committed to, the diversity of Bridges programs and the Sparks program, which I helped start 12 years ago, is also reaching out to a diversity community of young people who aren't necessarily given opportunities to work in stem cell labs. And here we reach out to state university students where diversity is much more robust than it is within the UC system, to provide them an opportunity to excel and clearly to be supported by mentors. And the people that are running these programs at the various institutions, whether it's Carmen Domingo at San Francisco State or others, they take a real personal interest in the students and realize how important it is. And many times the stipends may be very small, but it has kept them in school because they couldn't afford to have stayed otherwise without it. So we're really providing a tremendous service. And I know these young people, any of you who can in the future attend a Bridges presentation program or a Sparks presentation program, will come away totally impressed with how incredibly bright these young people are and what a resource we're helping to develop for the state of California.
Thank you, Senator Torres. I want to echo those, all of those statements. I invite members of the board at the end of the year. There's always a conference of the either the Bridges or the Sparks students where they make presentations on their work. And it is always striking how competent and wonderfully engaged all of these students are. And it's, I think, a real credit to them and to the program directors who run these programs. These are absolute winners, although we're not getting to Spark at the moment, but with respect to all of these. So I just want to reiterate. Dr. Brashear, I believe you have a comment.
So as being a relatively new member of the board, I was so pleased to see this and that we're developing pathway programs for the next generation that are going to be doing stem cell investigation. And I'm pleased that I have two other UC deans on the screen with me. And this is one of the things we're all committed to developing future people who are in this field and then having future role models so that we have continual renewal. So I was really pleased.
Thank you. Dr. Duliege.
Yes, and I couldn't more agree with everything that was said before, but I have a few questions or comments. First, one is, was it possible or would it still be possible to understand what was the yield of the previous program? You know, you mentioned that there were more than 2,000 grantees, which was phenomenal. But have we captured actually how many of them continued in biotech? How many of them, what was the yield is the best thing. I know it's difficult to collect, but I'd be interested. My second question is what are the key differences between what is proposed versus what was done? Are we doing pretty much the same, a second act of what we did, or are there substantial differences or improvement? And my last question is, what is the justification at a high level, no details, on the $65 million? I'm a little surprised because if I look at the fact that we suggest to provide $3.6 million by institution or teams for up to 10 trainees for 5 years, that is a huge amount. And so I'd love to better understand the math here. Thank you.
Okay, absolutely. So with regard to outcomes, it is something that, as you said, it is challenging because once the students leave, it is difficult to track everyone down. But we have done surveys over the years in terms of where the trainees have gone, and certainly the vast majority do go on to having a position, often at the lab that they were interning in. So, for example, if they intern at a company lab, very often they will get a job there. There are many who move on to either graduate school or medical school to continue their education, often because they are inspired by the research that they do. We do have some numbers that we can provide you. They were not part of the slide, that we can certainly circulate that reflect some of these outcomes that we have presented previously, and that we can certainly provide to you so that you have that available. Your second question was related to how this program is different from the previous one that we have done. In broad scopes, it is largely the same program, with just some minor modifications to address Prop 14 requirements. So I'm just going to move back. So some of the requirements under Prop 14 was, for example, the matching funds and in-kind support as a area of priority that would be allowed. We are changing a couple of things in terms of allowance. It's not necessarily reflected in the slides as I go through these, but for example, since the scope of research for CIRM has broadened to include, for example, gene therapy, that has become something that is allowable as an activity for the trainee. So beyond stem cell research, they can do that as well. We have also created a little more flexibility in the advanced cell culture techniques course, where, for example, in the past, it was a human embryonic stem cell culture techniques course. We've created flexibility to allow for learning about cell culture in more generally, but that it be focused on the culture of therapeutic cells, and to allow more flexibility in that area. So generally, that's where the changes from the previous program exist.
If I may,
yes.
Sorry.
Go
Jill,
ahead.
just to supplement what you said about outcomes. So there were almost 2,000 trainees in the Bridges program. 51% were first generation college students. This involves 60 host institutions where 67% were academic and nonprofit and 33% were biotech. In terms of long range outcome, over 60% of them were able to gain employment in R&D positions, 67% in academic nonprofits, and 33% in biotech pharma. 35% went on to PhD professional, med school, or other graduate programs. During their, and this has all been presented by Dr. Kelly Shepard, who's done a wonderful job being the program officer for this. During their internship, they've contributed to over 274 publications that we can track, and that's during their internship time. So the outcomes were so good, and we had the team really scour and make sure, I had them pressure test to say, okay, if we're going to bring this concept forward, was it working? And so the reason why there were refinements in terms of just making sure we updated regarding, the opportunity to exposure for the, given the progress in the field, and, we'll set the stage for specialty type exposure to things like data science and manufacturing opportunities even more in the future. But we did think that the basic program was very, very solid. So I just wanted to kind of pipe in because I wanted to, these results had all been presented to the board, but in the context of this discussion, I wanted to make sure to remind everybody of the outcome. Thank you. Thank you, Gil.
Sure, absolutely. And just to address the question of the 65 million. So What we're outlining here, so in the past, we have had up to 16 programs, and we currently have 14 awards for bridges. And so the amount is for obviously 5-year awards. In the past, we have had them be 3-year awards, and so that certainly has added to the cost. We made some adjustments to update the stipend amounts and research supplies, which we increased by a small percentage. It was not huge. So generally, the program itself is largely still paying pretty similar amounts to what was done in the past. And so, I think the 65 million in part is a reflection of the up to 18 awards that we are targeting, or at least that we want to allow for, and the longer duration of these awards of going from 3 years to 5 years.
I think it's important that, Maria, as you outlined, because sometimes board members are, and I speak for myself, are so busy we don't always read everything, but it's good to be reminded of the success rates of these programs. And I think if we can just send out a quick email to all the board, especially the new members, to let them know how successful this program has been and the return on our allocations, I think is extremely important, because when I report to the legislature, I try to do that as often as I can, because sometimes they don't always read the material that we send them initially, but we have to repeat it so that people get the message of what these young people are experiencing. Thank you.
So thank you, Gil. And I know Isabel wants to talk after, but I just wanted to respond to your comments, and I agree with everything. Glad to be reminded about the success of the previous program, and I think this should be touted, possibly even more. I'm slightly uncomfortable with the dollar amount here, and there may be a math that I'm not doing right. And again, I don't want to get into the details of how much I believe that increasing the stipend when the cost of life has increased in California is great. But if I understand correctly, $6.3 million per, let's say, institution for
3.6, right?
3.6, yeah, per institutions for up to 10 trainees for up to 5 years. That's what I call 50 trainees years. And if I divide simply 3.6 by 50, and if I'm correct, that's $72,000 per trainee per year.
That's right.
Knowing, having a rough idea of what a stipend might be for a young person in their 20s, usually, I find it hard to justify, again, just at this level, but maybe I'm missing a big picture perspective here.
No, I think that, I think your calculations are correct. It is an investment where we're having, trainees that are at institutions go spend a year at a different institution. So part of what the stipend covers, which is basically about 36,000 per year, is to make sure that the trainee can live in the new area. So for example, somebody from Humboldt spending a year at UCSF. So a lot of it is providing that stipend for living allowance, and that, as well as providing a supplemental research fund so that they can.
Gil, I'm so sorry to interrupt you, but I'm careful of the time we're spending on that. I'm sorry. I completely understand cost of life. Believe me, I'm dealing with that with people that are in early in their life. I don't get the math. For me, $3.6 million per institution is $72,000 allocated to this institution and the grantee to cover everything that costs about a year. And I'd like to challenge that. So again, I applaud the program. I'd like it potentially to be larger. I think everything is going well, but if for us to bless a program that at a high level tells us that it costs $72,000, everything included, to train one person at an institution for a year?
Gil, may I pipe in, Dr. Deliege? Gil, that amount that we're talking about, that's all in costs. That includes the faculty that would be involved, program development and everything, correct? Materials and.
Yes. Yeah.
So part of it, Dr. Deliege, is not a per student cost per se. It's just that it's the infrastructure, the systems, the curriculum development, and the support of staff that would be built in to supporting these students. And maybe Gil, I don't know if you have the numbers on hand, we can give an idea of what actually the actual stipend is, because the students.
No, Maria,
Okay.
I'm so sorry, because I really don't, I know we need to move on as well. I really don't want to get the details of what the amount of stipend. I totally trust the CIRM to do the right thing, and they know all of that. I still would challenge the fact that even if you take, there's no person who's going to full-time be allocated to these 10 students. There's going to be a little bit of their time on their salaries otherwise. And at a high level, I think it's a lot. And I don't know necessarily that we're spending, that sounds very too generous to me. How can I say it? And also, I'm not too sure that there should be the same stipend for biotech companies that have their own revenues versus an institution. But I don't mean to get into that details. I'm saying at a high level, and I'm curious to know if I'm the only one of the board to react to, again, big picture perspective.
Dr. Deliege, just to confirm, it's 50 grantees, it's 50 students per institution because it's 10 per year for 5 years. So
yes, that's what I say. That's exactly right, Maria. So $3.6 million divided by 50
sure.
is $72,000. That's the total cost, everything including cost of their supervisor's time, their desk, their pipettes, their stipends, everything for a year.
Right.
I ask, this is Christina. I assume, since this is a grant funding mechanism, that total cost also includes overhead cost. That's anywhere from 50 to 75%, depending on the organization in California.
It's only 10% in this case. So for training programs, we limit it to 10%. Most of the costs go to, as indicated, the stipends, the coursework, the program administration, which means hiring employees, as well as having the program director, tuition and fees, and then we provide an amount for research supplies. So all that, adding up to $72,000 per trainee is about what it comes down to.
Well, I would like to give an alternate opinion. I really think that the cost is fine, and as one who works with programs for students on a daily basis, the concept of educating students has always, sometimes seemed to be such that the general public doesn't understand how much goes into it in terms of the time and in terms of administration and staffing. And I know meets the eye, it looks like a large number or a significant amount. However, when you think about staffing that has to be directed to this program for the students, as well as following those students throughout the year of the program, it's not a significantly high cost. And I know sometimes we may compare this to what a graduate student may get or what a postdoc may get, but it's offering significantly more, and people's effort has to be designated, and you can't just put a little of this person, a little of that person. They really do need to have sufficient staff to operate the program. So I would say that I don't see that the dollar amount is out of line.
This is Dave Martin. I actually think it's out of line because it's not adequate. I'd be
Yes.
interested in what Keith thinks of that, Keith Yamamoto.
Yes, I would agree.
Are they provided health insurance at all through this, or is that just verboten? What are the benefits that they get as essentially as a trainee? There's 72,000 is not much when you include everything on that line of tuition, fees, research supplies, et cetera.
So Dr. Martin, that excellent question. Let's just table that. We've got a number of hands raised here I wanted to get to, and we'll circle back to that in a second. Mr. Julesgaard, I believe you were next.
Yeah, I lowered my hand, but I think, and this is to sort of integrate with what Anne Marie was talking about, what would have been helpful is a build from the bottom to come to what this sum is. How did you get there? And what we're having is just an explanation retrospectively, as opposed to a slide that shows, here's the particular costs and here's how they sum up to this number. That gives one a lot more confidence that, we've got a good number here, as opposed to one that, is not as clear as one would have hoped for it in something like this.
Thank you, Mr. Julesgaard. Dr. Abdul Haq is next.
Yes, thank you very much. Yeah, this is a very valuable program. And my question was, is there a process in place to make sure that trainees from underserved or less served geographical areas like the Valley have equal opportunities for these grants and training opportunities?
Dr. Sombrano.
So the structure of the program is intended to reach out to institutions like the California State Universities and community colleges to recruit, to the extent that they can, a diverse cohort of trainees. And so in many cases, they will partner with other universities or institutions in either the relatively regional area to try to bring in as diverse a cohort as they can. And that's part of also the element that is reviewed by the grants working group for applications that we receive who would like to have a Bridges program.
All right, thank you.
So we heard Dr. Martin's comment. Dr. Yamamoto, do you care to respond?
JT, Larry has his hand up, by the way.
Okay, all right, thank you. Do we lose Keith? Is he on there? Maria, do you see him?
I do not.
Okay. Dr. Goldstein.
Thank you. I have two comments. One is on the budget. So I presume that these are average or max costs that are anticipated per grant per institution. But if this is running like an NIH training grant program, the institution submits a budget that is reviewed by the grants working group, I presume, to make sure that the budget is reasonable and in line with what actual costs are going to be in that locale. So I'm guessing that the budget actually does get reviewed. It's not just a blanket allocation to an institution that applies. And I hope Gil will correct me or not on that in a few moments. Second is just a sort of, I hope, helpful suggestion. There is an increasing emphasis on data science, computational science, and engineering of devices needed in stem cell biology. And I'm wondering if there's some way to at least encourage applicant institutions to be sure that they're advertising in those departments, because they're often not hit. I think usually the catch basin is biology students, not engineering, not data science, not computer science. And I think it would be important to try to attract those students as well.
So yes, I can confirm that the GWG does look at the budget as well as the number of trainees, and as well as the design of the program in order to support the number of trainees that are intended, and the partnerships they have with host institutions in order to ensure that the program makes sense. But that said, we also provide, amounts that are sort of maximum amounts that they can request. And so these are, as you say, maxed out to some extent. But for example, the research supply amount is pretty standard. We provide an amount that will go to the lab that usually doesn't vary. But nevertheless, it can be subject to GWG as well as CIRM review in terms of allowability and appropriateness.
Okay, thank you. Other comments by members of the board? So, Gil, I've got a question. Can you put that budget slide back up for a second?
Sure. This one?
Yes. So am I, not sure I'm remembering this correctly, but with the first go around back in the day with the Bridges program, didn't we have different amounts for different host institutions based on their size and ability to handle numbers of trainees, et cetera? Or do we do it pro rata like this is recommended?
So we did it the same way. What you're talking about is something we did for the research training program, but for Bridges, the allowable maximum amount was the same.
Okay, thank you. Okay, any other comments from members of the board? Comments from members of the public? Do we have we had a motion on this? I don't think we have yet. Do we have the motion to approve?
Yeah, I made the motion earlier and there was a second. David.
Okay,
David.
thank you. Thank you, Art. Okay, Maria, will you please call the roll?
Haifa Abdulhaq,
Yes.
Dan Bernal,
Yes.
George Blumenthal,
Yes.
Linda Boxer.
Yes. Yes. Sorry.
Oh, no problem. Alison Brashear,
Yes.
Deborah Deese,
Yes.
Anne-Marie Dulege,
Yes.
Isabel Duran, Elena Flowers,
Yes.
Judy Gasson, Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Linda Malkus,
Yes.
Dave Martin,
Yes.
Shlomo Malmed, Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Francisco Prieto,
Aye.
Robert Quint,
Yes.
Al Rolette,
Yes.
Michael Stamos,
Yes.
excuse me, hold on for 1 second. Oz Stewart,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Vori,
Yes.
Keith Yamamoto. Motion carries.
Thank you, Maria. We're going to continue on this item on to a discussion for the research training program. Dr. Sombrano.
Thank you, Mr. Chairman. So the research training program is what we initially launched back in 2006 as our first funding opportunity. And so this is a proposed return to a program that is almost the same or largely similar in order to support predoctoral, postdoctoral, and clinical level trainees. The objectives overall are to enable training to create future leaders in stem cell and gene therapy and regenerative medicine fields, to foster a commitment among the trainees to a goal of accelerating the delivery of treatments to patients with unmet needs, to broaden the participation in regenerative medicine of individuals representing the diversity of California's population, to provide research training in stem cell, gene therapy, and related disciplines to a diverse cadre of individuals drawn from a wide variety of scientific backgrounds. Also to promote interaction among trainees from different fields, especially those that are trained in the basic sciences, engineering, translational research, and clinical medicine. And also to prepare a workforce of skilled stem cell ambassadors with an awareness and appreciation of the inequities and impact development of therapies for all people. So the structure of this program is mostly focused on mentored laboratory research. So this is in stem cells, gene therapy, or a regenerative medicine related research. And the expectation here is that trainees are working towards their graduate degree, towards acquiring a faculty position or other career advancement, if, for example, they are a clinical fellow or such. All the training program, all the training programs have to offer one or more classes in stem cell or regenerative medicine and its application to health and disease. There is a required course in the social, legal, ethical implications of stem cell research and regenerative medicine, and a specialized course in some other area that would have high relevance to the advancement of regenerative medicine approaches. And so that's where the program has flexibility depending on the institution and perhaps their area of expertise to provide additional coursework. It also requires patient engagement and community outreach activities in order to raise awareness of patient needs and to foster sensitivity around the issues of access and inclusion that differentially impact communities in California, particularly those that are disadvantaged by socioeconomic status and other factors. So for this program, given that there are basically the three flavors of trainees that can come in, and with a desire to have an impact on the degree acquisition or advancement in their career, there is a minimum period that we would want to suggest for each of these trainees. So for a pre-doctoral graduate student, we would like to see them supported for a minimum of 3 years. And for postdoctoral fellows or clinical trainees for a minimum period of 2 years. So the program budget allocation for this looks like this. There would be an allocation of 100 million to support what would be about 20 awards with a 5-year duration and up to 5 million per award. Similarly, this supports trainee stipends, which are variable depending on the level of training, fees, research supplies, travel, coursework, and program administration. And so we request board approval for the proposed research training program concept with an allocation of 100 million. Mr. Chairman.
Thank you, Dr. Sombrano. Do I hear a motion to that effect?
Move.
Seconded, Michael Stamos.
Thank you. Comments by members of the board?
I'm not clear on the number of trainees per award, or those in per trainee.
Right. So it's going to vary from institution to institution depending on the type of trainees that they can support. And also because the stipend amounts vary. So they will range from about 36,000 to 94,000 per year, depending on the level. So, you know, the pre-doc being at the lower end and the clinical fellow being at the very top end. So the institutions have the flexibility to work within and propose what's appropriate for their institution up to 5 million.
So, you know, here I raise my hands, but John Thomas, can I comment here? Is that okay? Yeah. You won't be surprised. The comment that I just made for the bridge program applies even more so here. I applaud the program. I also trust CIRM to do the right thing and to be very aware of cost and being, you know, in general cost conservative. But at a high level, here again, even more so, I cannot reconcile the math, and I'm asking my fellows on the board to tell me if I miss a big picture item. But here, what I understand is that on average, the amount of money that an institution, biotech or institution, will receive per award, per person, per year is $1 million. Or that's the total cost. And I'm surprised. I'm actually uncomfortable. I'm comfortably surprised and uncomfortable with it. And I welcome others' perspective.
Dr. Sobrano, can you respond to that first, please?
Yeah, well, again, it varies. It's going to vary by institution and what they propose.
I'm talking about averages. Yeah, we don't want to hear of the extremes.
Right. So it, you know, so if they, you know, this is about, as you said, $1 million per year in order to support what could be 20 trainees, it could be 10 trainees, and you know, the number will also vary for how long, right? So if, you know, for 5 years, it means that they would, you know, if they abide by the rule of a 3-year minimum for a pre-doc, it means that, you know, they're going to be more limited on the number of pre-doc students that they can have versus the postdoctoral and clinical fellows. But the range of students in a given year can go up to 20 and, you know, be as low as you know, maybe 8 or 10.
So maybe that's actually a major clarification that you just made, and thank you, but I want to make sure that I get it right, because it's not so clear on that slide, and hence my confusion. I do hope that I'm confused and that the reality is more reasonable. What I read is that if an institution, being a biotech or an academic center, takes the responsibility for these postdoc training for anywhere on average 5 years, but it could be 3 or so, that institution will receive from CIRM $1 million per year. And what I heard you tell is no, it's up to 20 for up to 20 people in this program, which then would become suddenly completely reasonable. So, I mean, please clarify. You know, for me, 5-year duration, $5 million per award is $1 million per award per year.
Right. So the way this program here is structured is, you know, basically creating a cap on the award with the institution proposing the number of trainees and the types of trainees that they can support with that amount, or less, right? So some institutions would not be able to claim a $5 million award, either because the number of trainees that they can support, the faculty that they have in order to support them would be much less. But, you know, when I said up to 20, it assumes that they're all the least expensive type, meaning the pre-doctoral students, as opposed to postdocs or clinical fellows. But if a program decides to have all 3 flavors of trainees, then it's going to be less than that. and it can be as little as 8 or 10.
Gil, I'm not satisfied by your answer, and I'm a little uncomfortable that there's no more transparency. I'm not asking details. I'm not asking the program that costs less and there will be a program that costs more. I'm asking if what I did when I did the simple math on the slide, meaning on average, if an institution welcomes one pre-doc, post-doc, clinical trainee, blah, blah, will receive what I understood being $1 million per year of that training. If that's not the case, please tell me, again, a big picture, one number that I can relate to. And if it's the case, I'm uncomfortable with that amount, $1 million per year per person.
Mr. Chairman, this is Art Torres. Anne Marie, I don't understand what you're using as a comparison. Are there programs out there that we should model after that are less expensive, is what you're saying? Or you're just looking at this in a vacuum, or do you have other programs that you may have comparable issues with? And I think that's an important conversation.
Art, please, I'm not looking at making this comment in a vacuum. No, I haven't done until I've seen these slides, my research of
I'm sorry. I thought you
programs. I'm not saying that, I have the ability to compare various programs. If I may say, I'm using my intuition here of cost of life. And I know biotech well, I know academic centers well.
My question was very simple, was whether you had programs that you knew about to compare this to.
No,
I understand.
the answer is no.
Thank you.
Okay,
Mr. Chairman, it's Maria Milan. May I just ask a question or just maybe provide a little bit of clarification, because I do think I understand what Dr. Deliege may be pointing to.
Certainly, and then we have Dr. Stamos after your comments, Dr. Malone.
So, Dr. Deliege, we completely appreciate your question here. I think one of the things that we need to bear in mind is that when we ask for these amounts, they are an up to amount, and then Gil described that there could be, a difference in terms of what types of trainees, and they may expend fewer than that. I just wanted to also, put into play that we, in addition to our GWG and budget reviews, that post approval, post board approval, when we do our contracting, we have milestone-based payments that are dependent on what actually gets done. So it's not that an institution would just get $1 million, and whether they get one trainee or 20, they're going to get that million. It really is going to be, it's milestone based on what the actual activities are. So we contract out that way, just like we do with our clinical awards and our other awards. So that's one of the safety valves. And then in addition, in constructing this budget, the team, and they did this for the Bridges program also, they laid out the kind of the costs associated with the various components in the concept proposal, which is a more detailed consideration of these concepts. But we can also do even more of a breakdown. But ultimately, it is just those basic kind of parameters that are what are put in place, and the statements regarding some differences in terms of what the cost would be for certain types of postdocs versus others relates to some cases where there are actually clinical trainees, and you're very familiar with this, having been a clinical trainee, where essentially their time would have to be bought from the program, because they're serving a clinical service, they're on the clinical wards. So for those trainees, maybe the budget would be higher than for pre-doctoral students. So there is quite a bit. It's difficult to say, because what happens is we put out these parameters, we put out the kind of the contours, and then the applicants themselves come to us with a proposal that's justified, and then we have reporting requirements and milestone-based payments, that partner with it. I don't know if that addresses all your questions. It may not, but I just wanted to make sure that we had that we made sure that was looked at in that context. Thank you, Chairman Thomas.
Okay, let's go to Dr. Stamos next, please.
Sorry, thank you. I have a lot of familiarity, of course, with all these different trainees. And I would just say that from what I heard from Gil, first of all, was that this is not going to be $1 million per trainee per year. It sounds like a minimum of around 8 and a maximum of around 20, depending on whether they're pre-doc, postdocs, or clinical trainees. So I'd like clarification if that's accurate. I think it is. And then second of all, I think I saw a slide very early on today that talked about cost sharing. That is, that institutions that were willing to co-invest would receive a little more priority. And I'd like clarification if that's true or not. And certainly these numbers in the budgets are very much what we're expecting for the kind of numbers that, if I understand it correctly, that this is proposing.
So the cost sharing is not something that it was part of this proposal. It was part of the bridges because it was a requirement under Prop 14. It is something that we can certainly include, but it was not intended to be part of this concept.
Dr. Duliege.
So very, very briefly, I'm not asking for details, and I understand that a pre-doc, postdoc, and clinical training don't cost all the same, don't last all the same. What I'd like to make sure that we all, as board members, are completely clear on the numbers at a high level, like on this slide. I don't think we need to dig more down in the trenches. And if these numbers are not accurate or simply, frankly, confusing, as I believe they are, and believe me, I deal with budgets of millions of dollars, so I know how to look at the budget. Please just clarify it. That's okay. If I'm wrong, I want to be wrong here. But even what you just said, Michael, is that apparently it's not for one person, but it's for anywhere between 8 to 20. So just tell me that I'm wrong. I have to be that. Also, I'd like in the future that we get a bit more an explanation of how these budgets were built. But ultimately, I'd love to have a simple question to that number. We all deal with averages. We know that some institutions are more expensive than others, and a one-year program is different than a 3-year program. If anyone could tell me how this budget was built and what was the average target for a year duration of a training at a given institution on average, that's all what I'm asking.
Chairman Thomas, may I screen share or?
Certainly.
Yeah, let me stop the share. Go ahead.
I'm just going to try to, hopefully I'm pulling up the right slide. Can you see this slide? Yeah.
Not exactly large font, Maria.
I apologize.
Maria, thanks for showing the slide, but I'd love to have just one single number. Again, I don't mean to dig 40 people looking at a detailed budget line by line. That's
so maybe just
everyone's time. And we can table that for the next meeting if CIRMs want to go back and I don't be more justification for this.
I'm sorry that you can't see the whole thing, but the postdoc average turns out to 79.5 thousand a year. A clinical fellow is about 105,000 per year. And these were kind of based on some NIH ranges. So I just wanted to make sure that, we could do better in terms of making sure this is part of the concept proposal presentation, and we take that input, Dr. Duliege, and we'll make sure that we incorporate it. But I just wanted to make sure that for this, as well as the Bridges program, that the board does know that it was not just a random number chosen, and then we're taking it from. It is actually built up. So that's all I wanted to share.
So,
thank you.
Maria, that will be my last intervention. I don't mean to capture all the airtime, but first of all, no, I never said, I want people to think that I said you picked up a random number. I know the CIRM way better than that. But second, I think you gave me the answer, which is on average, the cost of one person in that program per year on average is about $90,000. That's my rough average between 80,000 to 105.
That's right.
And if that's the case, that's all the number I was saying. I find that way more reasonable. And there's anyway, I'll say it.
Thank you so much, Dr. Duliege. I'll stop my share and we can make sure this goes around.
Thank you. Dr. Melmed, you're next.
Basically, I think the answer to Art Torres' good question is just let's have a comparison to T32s. Institutional T32s from the NIH are very similar. And I think a very simple answer to Art would be if Gil could provide us with just a high level comparison. But the numbers that we just saw from Dr. Milan are quite compatible with that, I think, just eyeballing them. We're a little bit high. We're higher than T32s, but not much higher.
Thank you, Dr. Melmed. That's very helpful. Dr. Prieto.
Yes, thank you. So I just wanted to respond as a long-term member of the GWG, because I've been a patient advocate member for perhaps a decade or more. And I wanted to reassure Anne Marie. At first, I appreciate very much that the stress on being good stewards of the money that the people of California have put in our hands to distribute. But I did want to reassure you that the members of the GWG are, for the most part, certainly all our scientific reviewers, are people who have extensive experience managing grants, being grant recipients, evaluating grants, and budget is an issue that is frequently discussed when a grant application is brought before us. Budgets that are felt to be excessive are certainly commented upon, and I think it's something that applications get marked down for if their budget is unrealistic. So I do think that we have a good process in place for evaluating those and targeting the outliers so that we do spend our money responsibly.
Thank you. Dr. Vori?
I looked at the two T32 grants that Slomo just referred to, the NIH training grants that we have here at our institute, and I can confirm that the numbers that Maria showed are exactly what NIH uses in training grants.
Okay, thank you. That's very helpful. Other comments by members of the board? So, Gil, I want to just get back to the question I asked about bridges, which you mentioned refers to the training grants. Did we in the past give the same award amounts to all institutions, or did it differ in terms of size and ability to manage numbers of trainees?
Right. So in the first iteration of this program, as it was under Prop 71, created three different types. So there was a type 1, type 2, type 3 program. And so each with the idea that if you can support one type of trainee, you would be a type 1. If you can support two different types, you'd be a type 2. And if you can support all of them, you would have a comprehensive program, and that would be well, maybe I have them reversed, but a type 3. And so the idea behind it was that you would then tailor the ask or the maximum award amount on that type of program and the types of trainees and number of trainees that you could support. Here, what we're doing is kind of creating a maximum amount in which is generally less than the maximum we awarded in the past, but for a large comprehensive program, but more than for the smaller programs, with the idea that that flexibility will allow them to structure their program as they see fit. In other words, allowing them to bring in different types of trainees without creating restrictions on, you can't have a postdoctoral fellow because you're a type 1 program and you applied only for pre-doc. And so the idea was to create flexibility in that program in that way. And so as a result, we moved away from the three different types.
Okay, thank you. And in the original training grants, what was the range of awards since they were varied per institution?
Right. So the range of awards, gosh, off the top of my head, I'm trying to remember. So the smallest award probably supported about 5 trainees per year. And in some cases, it was just postdocs or just pre-docs. And so the total award amount was under $1 million. Whereas, the very large comprehensive awards that trained all different types and had a larger number of trainees was at about the 3.5 million or so, or even up to 4 million. But remember, this was for a three-year award as opposed to a 5-year award as we're proposing here.
Okay.
JT Oz has a question.
Yes, Dr. Stewart.
Yeah, thank you. My question is about sort of the grants management side of things, and maybe the answer to this will sort of relieve some who still may have concerns. So let's take an institution who receives a large award that actually supports trainees at different levels. That institution may or may not be able to fill all the slots that it is approved to fill. If it can't or doesn't, does CIRM recover those funds? Thank you.
Yeah, so generally we recover funds from unused slots. That certainly happened in the past. Sometimes, even the opposite occurred where, as a result of unused slots in a given year, we allowed an institution to add another trainee in a subsequent year. So there is some flexibility, but ultimately, if they don't and can't use the funds, we will recover those.
Thank you. And, I asked that question just to emphasize that it's not like this institution gets $1 million and it doesn't really matter what they do with it. In fact, the program is managed a lot like NIH, and that it really is based on the award of fellowships in the way that was promised in the original application. And again, I just compliment CIRM on doing it this way. I think it's the right way to do it, and indicates the sort of maximal amount of oversight and management. Thank you.
JT, Anne-Marie has her hand raised.
Dr. DeLiege.
How many trainees are expected to be covered by this program total?
Yeah, so I again, it's hard to know because we don't know what types of trainees, because the type of trainee is going to determine how many each institution has. So it's difficult for me to say exactly how many.
No, Gil, I'm sorry. You're providing us a budget. The budget is based on some estimates. I'm asking you, what was the estimate that you used, or CIRM, I'm asking CIRM, the estimate that you used to calculate your budget, and particularly how many trainees would you expect, so either an average or maximum one number, to be covered by this program, so that we can understand, because the slide was confusing. I was most reassured by Maria's giving us the number that I was looking for. On average, you will give an institution $90,000 per year per trainee. That makes a lot of sense to me. That's actually not too high, not too low, just right there. But still, you're asking us to vote for $100 million, and I'd like to know the delta between 90,000 per trainee per year and 100,000. When I do the math, there's quite a bit of delta. So my question is simple. Gil, Maria, anyone from the CIRM, when you put this budget together, what was your expectation, your estimate in terms of number of trainees that would be covered? Maximum, for instance.
So Gil, maybe you could give the calculation. If they were all pre-doctoral students, how many could a program support? because Anne Marie, we don't know what an institution is going to end up getting, because it could be that they have all pre-doctorals, they may all have clinical fellows. So the idea is that the proposal comes in and they're only paid for the trainees that they get.
Maria, I think we'll need to move on at some point. Maria, I'm not asking these details. I can only assume, and I truly hope, that to put this budget and to ask for a vote of $100 million, there was an estimate of the people it would serve. When I'm doing a clinical trial budget, I don't know exactly how many each clinical center will enroll patients, but I have a very good estimate of what will be the cost on average of each of these patients. And that's how I'm building the budget. That's all what I'm asking. If you don't have it, which surprises me, I would be happy to make the recommendation. And of course, I'm looking to my fellows on this board here to table this vote to next time. And we meet quite often now to come with a high-level budget that we can all feel comfortable with.
I think that's an excellent recommendation. And rather than coming back to the board, why don't we go back to a subcommittee that can review in depth, of which Anne Marie is a member of, and not take up the board's time at this point, but to do a subcommittee work, do a deep dive into these numbers, and that way we can have a better idea and then report that out of the subcommittee to the full board. Does that sound okay?
So absolutely, because I'm comfortable putting using so much airtime on this topic, yet the topic is important. I'm happy to be part of this review. I would not ask for a deep dive. This is not the mandate of the board. The board, and I want to stay at a high level. I just want to have simple numbers that I can reconcile and bless, out of respect for our mission here. So
right.
Anyway.
That's why I suggested, Anne Marie, that a subcommittee of our full board look at this more and then report back to the full board.
Yeah, I'm totally fine with that.
Okay, so we have that as a suggestion. Gil or Maria, do you have, before we sort of have further discussion on that suggestion, do you have have thoughts on Dr. Duliège's question?
Maybe I can schedule a meeting with Dr. Duliège and then we can figure out from there what's needed. Because we do want to respond to your questions, Dr. Duliège. We do have answers, and they would be, it's the maximum amount that could potentially be covered versus, the minimum amount of trainees that could potentially be covered with this budget. Because short of that, I don't think we'll have an answer, because until the actual proposal comes in from given institution and until there are actual trainees brought into that, we won't have those numbers. So that particular question is going to be tough to discuss in any forum, subcommittee or not, honestly. So I think it may just be a better understanding of how, of how these numbers one can look at in terms of numbers of trainees that it could support. Other than that, I have no suggestions, Chairman. I don't even know what would it go to the application to the science subcommittee, or what subcommittee are we referring to at this point?
Finance. It would be the finance subcommittee.
JT, on the other hand, I wish there was a way that perhaps Maria could meet with Anne to resolve the questions. However, it doesn't seem like the majority of the board members feel that this is a sticking point. At least that's not what I'm hearing. And it's very clear to me that how this funding is going to be done, and to table this because we need to explain it to one person. I really don't think we should do that. I think we should put this to a vote and have Maria meet with Anne Marie to resolve her questions.
Well, I think excuse me, speculating we're going to have more than Anne Marie concerned on this point. Sounds like Senator Torres is as well.
No. I'm not concerned about it. I'm ready to vote aye as I was on the Bridges program. I just thought that was a suggestion, but I agree with our dear Dean from UC Riverside. I think that would be a great idea just for Anne Marie and Maria to get together and Gil and come out with what needs to be looked at more definitively and take into account from our dear friend at Cedars and clearly from Christina as to what goes on with the NIH in similar programs. So we have a comparison of the fact that we're doing okay and that we're following basically what the feds are following. So I withdraw my suggestion.
Okay, thank you. Any other comments on Dr. Duliej's suggestion? So, Dr. Duliej, I think what we'll do, I think we definitely want to run this to ground for you. It does sound like there is support to go ahead and vote on this at the moment. We do want clarity for your purposes and every other board member. So let's, I would propose, based on this very good and worthwhile discussion, and thank you very much for raising all these points, that we do, unless the board thinks differently, proceed to a vote here on the motion and have a meeting for you and other members of the board who want clarity on these issues subsequently to get you the answers that you need, if that is okay with members of the board.
And the fact that the board can revisit this issue at a later date as well. That's not out of the question.
Sure. But again, I do want to thank Dr. Duliej for raising these concerns, because they are viable, and I think there are very good answers to these, but thank you again. Are there any
Mr. Chairman?
Yes.
So very sorry to interrupt. I just wanted to say, because I've been getting fed some numbers from the spreadsheets that might be helpful. So if you look at across the 5 years and for the investment, if all of the trainees were at the clinical level, right, that's the most expensive, you would have about 160 clinical trainees. If you look at the other extreme on the all pre-doc, you would have about 360 trainees that would be allowed, just as a general range.
Is that per year or total over 5 years?
Total.
Thank you.
Yeah, thank you. That's helpful. Any other comments by members of the board?
Steve Julesgaard has his hand raised.
Mr. Julesgaard.
So I would just, from my point of view, we're spending taxpayers' money, and our job is to be sure that it's being spent in a wise fashion. And I think what Anne Marie was pointing out along the way, and what she's used to and I'm used to, are the numbers that go behind the numbers. How did you get there? What's the build, as we call it, in order to be confident that, that this was right-sized, the numbers made sense, et cetera, so that we can, when we vote, and we vote yes, which I will do in this case, because now we've got that additional information, but that we can vote with confidence that we're doing a wise thing in spending the taxpayers' money this way. That's all.
Thank you, Mr. Julesgaard.
We will Chairman Thomas, we take this feedback, and we will improve, our process for bringing concepts to the board to include the budget build in the presentation. So thank you, board members, for your feedback.
Thank you, Dr. Milan. Any other comments by members of the board? Any comments by members of the public?
We do actually have 2 comments from one member of the public, Mr. Jensen. So the first one is, please put this up during the public comment period if Gil does not deal with it. If I recall correctly, the board has indicated it wants better data on outcomes of the training and education programs, particularly in terms of diversity. Will the Bridges and Scholars relaunch require better data from recipient institutions? What sort of measurements are needed? So we can deal with that one first, and then I will read the next one.
Dr. Sombrano or Dr. Milan, would you like to respond to that?
Thank you for the question. In fact, as part of our strategic planning and operational improvements. We are working to make refinements to our reporting process. We do capture some data, but we are trying to get additional input to kind of bring it up to the state of the art so that we really can capture in the best possible way data sets related to diversity, equity, and inclusion. And then also to build it into how we measure, how we use metrics to guide, what the status is of programs related to those parameters. And some of those things you'll start to see as we continue to refine and roll out our programs. They're embedded within our strategic planning.
Thank you, Dr. Malone. Maria, what was the second comment?
The previous training program produced 940 alums at a cost of 117 million. If I'm figuring this correctly, the average cost per each trainee is about 124,468, or am I wrong? How does this average cost per trainee in the past program apply in the new version?
What was that?
That was from David Jensen.
Oh.
I think we've dealt fairly extensively on this question, but Dr. Sombrano, if you'd like to further respond.
Right. So I think that average was, basically what was shown in the spreadsheet. That for a postdoc, it is somewhere in the range of about 90 or so thousand, just on average.
Okay, thank you. Thank you, Mr. Jensen, for your questions. Do we have any other comments or questions from members of the public? Hearing none, we've had a very robust discussion on this. I think we're ready for a vote. Maria, will you please call the roll?
Ifa Aldihak,
Yes.
Dan Bernal,
Yes.
George Blumenthal, Linda Boxer,
Yes.
Allison Bashir,
Yes.
Deborah Deese,
Yes.
Anne Marie Dulege,
Abstain?
Isabel Giron, Elena Flowers,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Linda Malkus,
Yes.
Dave Martin,
Yes.
Shlomo Mohamed,
Yes.
Lauren Miller-Rogan,
Yes.
Adriana Padilla,
Yes.
Francisco Prieto,
Aye.
Robert Quint,
Abstain.
Al Rolette,
Yes.
Michael Stamos,
Yes.
Oz Stewart,
Yes.
Jonathan Thomas,
Yes.
Art Torres, Christina Vori.
Yes.
The motion carries.
Thank you, Maria. Now we get to item 7, which is the most riveting and substantive item on today's agenda, which is consideration of adoption of February, March, April, May, June, July, November, and December 2020 meeting minutes. Do I hear a motion to that effect?
Motion from David in San Diego.
Thank you, Dr. Higgins. Is there a second?
Second, Dave Martin.
Thank you, Dr. Martin. Any comments on this item by members of the board? Any comments by members of the public? Hearing none. Maria, will you please call the roll?
Yes. Haifa Abdahak,
Yes.
Dan Bernal,
Yes.
George Blumenthal, Linda Boxer,
Yes.
Allison Bashir,
Yes.
Deborah Deese,
Yes.
Anne Marie Dulege,
Yes.
Isabel Duron, Elena Flowers,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Jane.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Linda Malkus,
Yes.
Dave Martin,
Yes.
Shlomo Melmed,
Yes.
Lauren Miller-Rogan,
Yes.
Adriana Padilla, Francisco Prieto,
Aye.
Robert Quint,
Yes.
Hal Rolette,
Yes.
Michael Stamos,
Yes.
Oz Stewart,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Vori.
Yes.
Motion carries.
Thank you. That concludes the action items on today's agenda. We're now down to public comment on any topic or any issue. Is there any such public comment? Hearing none, that concludes today's meeting. I want to again welcome our newest members and impending newest members. This was a great session. I think the level of board engagement in these all of our meetings has been terrific, and very, very pleased to have such a wonderfully engaged and august group. So thank you very much. And with that, Maria, the date for our next meeting is?
It's in March, and it is, I believe, let me make sure, the 23rd, March
Okay.
23rd.
Thank you. And as you will recall, members of the board, that is a board retreat at which we will be dealing with a number of issues, including, as I said off the top, the report on this last Monday's excellent scientific strategy advisory panel meeting. So we look forward to that. And with that, thank you for your time. We stand adjourned.
Thank you, everyone.
We're not going to Cancun. Thank you all.
Thank you.
Thank you.
Adios.